about, are you doing the things that you were doing before that were actually keeping you healthy, or have you stopped doing some of those things, and what's it going to take to get you back on track? So they can help prevent relapses, and they can also help you get restabilized if you do start to slip. So that's the message, turning the doctor's office from a dangerous place to a safe place and a supportive place. And that's the end of my presentation. So I'm going to turn it over to Mark now.
Okay, so what I'm going to do is give you guys, I'll take over where Matt left off, although he gave a lot of great examples of the problems in a person in early recovery going to the doctor's office. And this is just my standard statement that I don't have any conflicts of interest. I'm not here to make any money. Nobody pays me to do anything except work. These are my buddies. Some of them are in the audience who taught me what I know. Most doctors have a very childish approach to treating patients who have addiction. And doctors who don't know much about addiction will do something. They'll talk to the recovering addict who may be 2 or 3 years in recovery, and will say things like, "I'm thinking about giving you Xanax. Do you think that would be okay?" And expect to get a straight response from the addict, which is really a difficult thing, especially if they're in a difficult position. These are my kids, and they are already know at 3 years old to ask their patient, the cat in the hat, how many meetings they're going to a week, and do they talk to their sponsor. So they're being trained early on. I don't know if they'll be doctors. The objectives of today's talk, what I really think is important to understand why drugs can be a problem, why going to the doctor can be a problem to people in recovery. You have to learn some basics about why addiction is activated and how drugs act on the brain. And by the end of this talk, in about 30 minutes, you're going to know more than most doctors do about addiction and how the brain works. That's called neurobiology, the function of the brain. For those, is there anyone in recovery in the audience? Great. I'm going to give you some ideas on how to talk to your doctor, whoever it is, about being in recovery. And we're going to talk about some specific issues regarding pain, insomnia, anxiety, and depression. How do you address these when you're an addict? And lots of times for questions. So what makes a substance or even a behavior addictive? It has to activate a center of the brain called the pleasure center. This pleasure center is very important to learning and just about everything. If you ever wondered why you know that you like chocolate and don't like going to the dentist, it's because your brain learns at this pleasure center what's a pleasurable thing and what's not.